Okay, everybody, good evening. Welcome to the fourth and final live day of NeuroEquity's Neurodisparities Advocacy Week. We really would like to thank you for hanging in there and continuing kind of looking towards the more action-oriented side of this week. So obviously now we've talked about our education with our first 2 days. We've had a little bit of conversation on social media, and now in our last 2 days here, we're going to be talking about, what you can do skills-wise and skills building-wise in order to really further the cause of working with healthcare policy and advocacy to further the conversation of healthcare disparities and just reducing them overall in general. And I think this is going to be a great segue in from what we talked about last time with doctors Abhishek Linagaria and Mil Etienne about current healthcare policy that exists. And now we can move into how we as med students are really able to at least, have our voices heard on these issues, which I don't know. I personally think that this is a big part of it. I think looking towards the future, advocacy as medical students is something that is super cool, and something that we're really able to speak on as people who are really going through it, especially, our clinical students, such as our presenter tonight, Diamler Vadlamuri, who is a medical student at the UQ Ochsner Clinical School in Louisiana. So I would just like to get right into it. You can feel free to start whenever you'd like, Daimler.
Sweet. Thanks so much, Phil, for that great introduction. Given that it's such a tight group today, I think that we can keep it a little bit more informal. Let me go ahead and share my screen here. All right. Y'all are able to see my screen? Awesome. Sweet. So we'll keep this a little informal. I myself have been learning a lot over the last year and some with regards to resolution writing, policy writing, how the entire thing works. So I feel pretty fortunate for everyone that's taught me. I want to give a quick shout out to my state medical society, Louisiana State Medical Society, our president, and a lot of our advocates who've done a lot of the work in, teaching us, telling us the next steps when it comes to how do we translate ideas into actions. I want to specifically thank Justin McGarth, who is the president of our state medical society, and also is part of the AMA, in a lot of the work that he's done in helping us with regards to resolution writing and kind of showing us the ropes. So I kind of just wanted to get a background before I move on here, with regards to how much experience or exposure you guys have on the call. I guess, Phil, you can go ahead, and then Daniel, I'd love to hear from you as to just kind of get an idea about if you've worked with writing resolutions before. Are you affiliated with your AMA chapter or delegation, and what your background is?
Yeah, so thank you for asking, Daimler. I have been involved in the past with my AMA chapter here at University of Louisville School of Medicine. Obviously with the quarantine and everything and just the inception of NeuroEquity, I'd kind of taken a step back from there. But in the past, I have been involved in resolution writing activities, and the writing of some of them. We had one for electroconvulsive therapy that I've worked on in the past. So it's something that I'm familiar with contributing to, and I think would be very interesting of a thought to be able to translate that to more focused, specialty-based advocacy work.
Thank you. Yeah, for sure. Daniel?
Hi, yeah. So during my first couple of years of med school, I did some work with AMSA and our chapter here, also on like a national level. I was part of one of their campaigns for like lowering pharmaceutical drug prices. I was really using that opportunity to kind of like learn more about advocacy and like how to use my voice as a medical student. I didn't get to like put a lot of it into practice while I was with them, and like med school just ended up getting so busy. And so that's one thing I hope we might be able to talk and address here, like how to advocate when you're so busy. Yes, now kind of like Phil was saying, like putting it more into a specialty focused advocacy, learning how I can kind of tie together my passion for neuroscience and also like advocating for my patients are kind of things that I'm trying to learn. And when I heard about this group, I got very excited.
For sure. Awesome. It's great to have you here. I think that, feel free to chime in as I go through this presentation. I myself am also a fourth year medical student who'll be going into neurology later this year once I get my ERAS and everything sorted. But and yeah, if you're interested in NeuroEquity, definitely reach out to us, join us. We have our social media handles right on the left over there. And specifically on the healthcare policy and advocacy front, we're looking for more members to try to do as much as we can. So all of that is still up and going. So I'll go ahead and start my presentation here. So this specifically is going to be a resolution writing workshop that's tailored a lot based on my state medical society and the information that they provided us as we were getting to write our own resolutions. We're currently working on a couple that are getting wrapped up that we want to introduce to our state delegation. I believe it's going to be later in April, the second or third week of April. And we're wrapping up a couple of those right now, one regarding telehealth and one regarding universal access to internet. And these are state specific, but we've had a lot of help in understanding how to do this. So we thought as part of the NeuroEquity Coalition, this would be great foundational knowledge to have to build off of. And as we work on other projects down the line, we think that we're hoping to utilize some of this, find people that are interested in some of this to get the ball rolling. So with that said, I'll kind of get into the overview of what I'll be talking about today, which is going to revolve around, first of all, what is a resolution? What's the purpose it serves? Why does it exist? How to make a successful resolution when you're introducing it either at the state level or national level. And we'll get into a little bit about how they differ specifically. Like you mentioned, Daniel, I know that AMSA also does a lot of work when it comes towards, policy making, resolution writing workshops. So they also have a lot of great resources, which I've checked on in the past. So if you're a member of AMSA, you have access to those as well, which help a lot. And then we'll specifically get into dissecting a few policies and looking at examples of resolutions and previous ones that we've submitted in the past. So if at any point anyone has any questions or just kind of want to jump in with your thoughts, just go ahead and do that. We can just take the questions as we go. All right, so overall, a resolution itself is a proposal that any advocating body can take a position or action on. Primarily for us as medical students, I think the best thing that we can do is research on various topics, get informed, pass that knowledge, and ideally come to a consensus on the position that we are taking. Specifically with NeuroEquity, something that I'd love to explore is the AAN has an AMA delegation that's open to senior physicians, residents, and I believe they take 3 or 4 members as part of their whenever they renew the delegation itself. And I thought that it would be great if, down the line, if NeuroEquity could get some footing in being a part of this delegation, working with them, even if it's just from the perspective of learning from them. But other ones that exist are, the ones through the AMA as well as your state chapters. And so ultimately, a resolution is kind of the currency by which ideas are discussed and down the line what policy is implemented and established from. And these are great because once an advocating body takes a stance on them, it provides a structure by which larger organizations can carry that through. So with something like the state medical society compared to the AMA, a lot of what could have gotten established at the state level could be carried on towards the national level and see if it could be further implemented. And when it comes to specific organizations like the AAN, the ultimate goal would be to be able to come to them with, an idea or a resolution, ideally, which has backing from different delegations or advocating bodies, which will give it a little bit more bearing in having the AAN take it more seriously, or some of the bigger ones. And ultimately, at the end of the day, the goal is to reduce inequity, reduce disparity, work towards a more equitable and equal healthcare system specifically. And in the process, we're also hoping to empower individuals and drive future action from this. And like I said before, it really helps form the basis for future policies that are generated. So once you have a resolution, where can you send it? As of right now, we have 2 concrete pathways, which is either introducing it to your state medical society or the American Medical Association. And like I mentioned, the AAN AMA delegation would be something that I think would be great to explore further. A few of the differences between the state medical societies and the national organization is the types of issues that are typically discussed or resolutions geared towards. So for example, the resolution that we're currently working on with regards to universal access to internet is specific to the state that I'm from, Louisiana. We've noticed there's obviously a huge disparity when it comes to the access of internet. 1 in 4 Louisianians, I think, don't have a subscription to an internet-based service provider, and therefore don't have access at home to something that we all deem as very crucial. So that is a little bit more state-specific, and typically state societies, medical societies have, I don't want to say an easier bar, but they are more open to the type of resolutions that are discussed and ultimately passed, as opposed to the national one. They're more high-level issues and meet twice a year in June and November, and have a more larger number of steps that are taken through. So to get into the meat of the substance and what makes a successful resolution, things that we should all remember are the issue has to be timely. I think that's pretty self-explanatory. Something that's currently an issue in our society today would obviously capture the interest of both state and national societies, and take on more of an interest trying to get them passed. Something that's new, novel, adds something to policy, advocates for an issue that previously hasn't been addressed or identified before. And it's also important to state the scope of your resolution. If it's state specific, you have to provide backing and data for specifically where does this need arise from. A great way to do that would be, identifying in literature the gaps that exist that calls a need for these policies specifically. Really taking into account which one would be the best one to send to. So, as a group that's geared towards reducing disparities within neurology, once again, the hope would be that we can bring up some of these issues to the AAN specifically, so that they can kind of act as a governing body, which would be willing to back some of our ideas or just work with us in what we could do better. And finally, establishing a need, I would say, is one of the most important parts of policy writing. Even if all else fails, if you're able to identify a key issue of need, I think that serves a tremendous, that has tremendous potential in getting passed and ultimately serving the people that we hope that it would. Okay, so to break these down a little bit further, so obviously we want things that are current when it comes to the timely nature of these resolutions, specifically in the recent past, things that have been interest to both our state medical society as well as the advocating body within Louisiana have been the impact of COVID and all the gaps that it's caused. Other things have been things like the opioid epidemic, telehealth, lack of telehealth or benefits and expansions of telehealth, and in general, ongoing issues that that affect people as well are something that's really important. The best example that I can share from this is regarding the we recently had a law passed in Louisiana that allows for the patient records, patient notes written by physicians to be made publicly available to the patient specifically. I shouldn't say publicly available, but made open and available to the patient. And I think there's a few issues that it can open up to, but also more transparency. So issues that kind of deal with the benefits and potential costs as well are something that are great to take a stance on. And as I addressed before, existing issues. And when it comes a little bit towards the novelty or what is it that you're bringing forward, it's extremely important that a thorough vetting process be done for the resolution you're trying to introduce and trying to determine whether something like this has been introduced in the past or does exist in the past. The best resource that I've been pointed to with regards to this is the AMA Policy Finder. If being a member of the AMA for medical students should be free, and as long as you're able to be enrolled, and essentially if you can just Google it, you'll have access to their database where you can search through all types of policies that they've passed in the past. You can break them down by topic, by year, by specific departments, and you can take a look for examples or ideas, as well as to make sure that whatever any idea that you might have that you are interested in introducing doesn't already exist in the database. I think, in addition to that, what I had just mentioned, a common mistake that me and my peers ran into as we were working on introducing what we thought were, pretty broad policies is the level of specificity that you go into within your language. So typically, blanket policies, something that tends to cover a lot of issues or take broad stances on things, isn't always the best approach. So an example that I can give you here, as you can see on your screen, is calling for a need to increase research for palliative care within refugee populations. So while that itself seems like a great idea, more specifically, it needs to call exactly the what it is within these policies that you're trying to address. So a great way for that would be breaking down by subsection, exactly what this policy hopes to be addressing, and what are the surrounding issues that legislation or support can ultimately help achieve that. So in order to give yourself the best chance of both outlining a policy that hits the nail on the head when it comes to the issues, kind of following this outline would be the best way in having a targeted approach to also addressing the audience and making them recognize why it's important and how this policy will ultimately achieve that. This is just another example of exactly how that could be achieved in terms of a new policy, what you're proposing, what currently exists, and how what you're proposing aims to achieve that. So it's kind of a basic outline that we follow through. And at the end, we'll go through some examples of actual resolutions, and I'll also break it down into what's an example of a good one, a similar topic, what's an example of a good versus not so good resolution. Moving on to the principles of the resolution, I think a few things to stick to would be talking about issues which in literature you're able to show that there is an existing gap. Over the last 5 years, I would almost even say for medical students, as we're getting into this, anything specifically over the last 3 years shows the best success in terms of garnering interest and support behind trying to get something passed. So that was a helpful timeline when we started brainstorming ideas within our policy team as to, what is it that we would like to address and how could we best do it. Kind of getting our time frame in order was the best way that we could determine what might be a best area within healthcare policy for us to work on. And as you can see in the graph down there, news source, so like things like your personal experience or other things that you might hear can be of great inspiration for ideas that ultimately will carry you through towards writing resolutions. In terms of inspiration, those are great, but obviously a lot of the meat of the work comes in being able to show where the need exists. So similar to as with any literature search that you'd be doing as part of your scientific work, going through that route and showing the need would be the best way that you could do that. But overall, just in terms of learning more about a topic, we have great sources out there that really break down all types of existing topics into further details to just kind of get a full picture on what exists on both sides of the coin in terms of what are potential pitfalls, complications, pros and cons before your society can nail down a specific stance to take on these topics. So it's obviously important to do your own due diligence before bringing that aboard. Okay, so we'll break down the anatomy of a resolution specifically and go through the structure of what would make it successful. And I'll have some pictures at the end as well. So let's see here. So in terms of the basic body of what a resolution would look like, you're gonna have the legislative body or the policy group or state medical society organization that is introducing this resolution and what the resolution is, and everything there onwards follows whereas clauses. So this was something that was interesting for me to learn, just in terms of how things are worded. It's very, very specific in the wording, geared towards resolution writing. And your whereas clauses really are kind of like your background of showing why, or showing what the gap is, why it exists, and what the big picture issue is overall. And when so for example, for something like internet use or telehealth, establishing how prevalent is the lack of internet within the state, what are some barriers to having access to internet or telehealth, are there specific groups that are marginalized within this, are all great resources to be putting into the body of the resolution to show its importance. And then the resolved clauses talk about the solutions that we are suggesting. So what is the actual policy that we would want to be adopted? And you want to be concise as well as action oriented in stating those clauses. And if there's any existing policies that touch on what you're trying to talk about, it's important to put them in there, as well as obviously all of your references to the resolutions. Okay. So for the structure, so let's see, yep. Okay. So being succinct, I'm extremely long-winded myself. I think, so for me, it was a process of learning how to be very to the point when it comes towards stating these resolutions. I remember when we were drafting out our first resolution, I think we had something around, I think it was close to like 10 or 11 pages of writing that we ended up putting together in introducing it, establishing our need, and we quickly realized that that had to get, cut down to 1 to 2 pages in showing and prioritizing the needs that exist. So an example here of 2 different ways to address the same topic would be, recognizing and treating the unique medical needs of refugees in order to mitigate immigrant health disparities, as opposed to just stating it as addressing immigrant health disparities. So at every step of the way, I think it's important to kind of go through what it is you're writing and try to shorten it as much as possible while maintaining the main idea. Yep. So we talked a little bit about the purposes of whereas and resolves. And so specifically within your whereas clauses, which is establishing a rationale, it's important that every sentence underneath those clauses does begin with the sentence whereas, and does end with semicolon and. And when you list out all of your rationale, the why, in your very last clause, you could end it with "and therefore be it," which kind of transitions you into your resolution, and it serves as a backbone, like I said, for explaining why this should become policy. And I think also it's important to remember cited evidence over opinions, because a lot of policy is, policy point blank is supposed to be evidence driven and not opinionated. Yep. And I think that when we're also talking about other ideas that are included within the whereas clause, it's important to not list, I guess, pieces of information that might have been introduced in the past but haven't transitioned into policy, just as a note. Yep, this is just a little bit more detail as to things that we touched on, as to what needs to go into the structure, and why current policy doesn't address it specifically. The best example I can give you there is within our state, there were a couple bills that were passed that circulated the topic of internet use and telehealth, but even though they were passed in the recent past over the last 3 to 5 years, they still didn't address the core need that our policy was advocating for. So it's important to make that distinction because things that are not clear for those that are looking at it for the first time, they might not have a lot of background knowledge that you do and all the information that you gathered. So it's important to delineate specifically how what it is you're introducing is different than anything else. There were 2 bills in Louisiana, I believe, regarding telehealth with two very, very specific policies that when we were talking to our group about, got a lot of not pushback, but got a lot of questions with regards to, well, why is it that these policies that were passed in the past don't address what it is that you're trying to say? So I think it's important to clearly outline any action that's been taken in the past and delineating how yours is different. In terms of your whereas clauses, as you are working on the structure of your resolutions, they should be able to, each clause is almost kind of like a mini paragraph within itself. It's one long sentence, and it should be able to, each one should be able to stand on its own and build on itself. And they shouldn't be totally independent ideas. They should be interconnected by a logical flow and thought, and the context that you provide within it should be offering a lot of the substance there. So here we have an example that one of our, I believe it was Justin, who shared this with us. I thought this was so great, so I wanted to copy this over. So here we have 2 different examples of whereas clauses that are trying to point out a need within resolutions, but just 2 different ways in which they go about. So you guys can read through on the screen between the difference between the left and the right, but you can see where I bolded specifically they try to establish a need. So where you look at the second whereas clause in the bad example, you're trying to point towards the fact that Star Wars hasn't gotten that much exposure, and because of this, they might not be appreciating Baby Yoda memes. But more so, to make a successful policy resolution, you need to be able to provide the statistics of 1 in how many residents, and how does that tie in to why they might be having certain displeasure. So I thought this was kind of a funny example to highlight that and hopefully give a little bit more context to resolutions or policies that we might be hopefully trying to address. Okay. Yep. So we kind of went through this a little bit in terms of the organizations that you're trying to appeal to, address, get the attention of, and what you want them to do about it. Recently, Phil and I had a call with one of the members within the AAN, who, as we were, talking a little bit about what we as medical students can do when it comes to healthcare policy and advocacy for the AAN, they pointed us towards past resolutions that the AAN has passed on its various topics, their stances, and kind of the work that they've done on that regard. So for us, as we try to work with them on what we could try to address in the future, even though the AMA or your state delegation might have policies that are geared towards addressing this gap, if something might apply to the AAN, I think that it's still important to be addressed through that governing body for them to either, support that resolution or offer amendments, or kind of them take a stance on what, an emerging issue within our society. So a couple examples of, to move on to what are resolved clauses, are to, again, highlight what's being proposed here. So these are a few examples of different resolved clauses where we call for an increased support in the different types of products, pharmaceutical interventions that currently need be, or requesting that a statement of support be issued for X, Y, and Z, and also putting in a rough timeline by when these hope to be achieved, or whether, it's to highlight whether will be an ongoing issue, something that's going to be a one-off stand because of how the issue is presented, or something that needs to kind of be addressed immediately. Specifically when it comes to language that's used within the resolutions, a lot of this, to put in context as well, is things you might face as you are writing them out. It's incredible the amount of work that's done between a first draft and like the final version, just in terms of all of the little things that are changed. So if you're just getting started, this might seem very nitpicky or extremely detailed, but this would be something to kind of save in your back pocket or come back and refer to as you are closer to wrapping up the resolutions you're working on specifically. We thought that this was incredibly helpful to put together, given a lot of the changes we found ourselves to go back to change in changing the language or structure of the resolutions we were proposing. And the big difference between resolutions that are coming from internal propositions versus ones that are coming externally. So for neurology specifically, insofar as NeuroEquity is separate, from the AAN, as we're two different organizations, any propositions that we make towards the AAN, we would be an external body in providing our resolutions to the AAN specifically. This is something else as well that you can put in your back pocket. This kind of goes into how you can phrase the importance of the resulting actions of what it is that you're trying to suggest, and kind of the verbiage that could be used when it comes towards how these are implemented within the policies themselves, and kind of tailoring. These are going to be dependent specific to the types of policies that you guys are thinking about writing or working on, but kind of following these themes tend to offer success down the line. I threw just a couple quick examples of links to more detailed resolutions, breakdowns of resolutions that were written in the past, that goes through, that highlights some of what we talked about, and that shows examples of a resolution that could be improved upon. So you can definitely refer to those. And I wanted to just touch on quickly, with a few minutes here, on some past efforts that we've worked on, that our state medical society has worked on, and what we've managed to get through in the past. Our state medical society has put forward resolutions on firearm safety and suicide prevention, electronic nicotine delivery system, talking about the need for healthcare specifically for the LGBTQ plus population, and as we talked about before, improvements to patients' data privacy. So I think that for NeuroEquity, what I think would be great, if we had more people in here, I would have loved to do a few breakout sessions, is to just brainstorm about what are some issues within neurology that you think there is a gap in literature for, or there's a gap in policy for, that just needs to be brought to attention. I think that ultimately that would be one of the biggest things that our subcommittee within NeuroEquity could work on, is at the policy level, identifying neurology specific issues that hopefully we can bring issues to light and bring more awareness about. I'm just going through and pasted some examples specifically of our past efforts, and so once our resolution was introduced and adopted, these kind of went into writing as kind of the stance that the entirety of our state medical society has taken when it comes to these specific issues. So for this one, firearm regulation. This one, like we had talked about, was with regards to the tobacco use and electronic nicotine delivery systems. Some with regards to patient data privacy, and LGBTQ plus care and climate change. So all in all, I mean, I think learning how to get into resolution writing, which has been relatively new to me, I've been doing this over the past year and a half or so, has given me an exposure into kind of understanding the pipeline of policy itself and how it works and where change starts and all that needs to be done for something to be enacted into law and ultimately, improve individuals' lives for the better. So I think as medical students, this is again a great first step for us in researching this on our own, highlighting what the need is, bringing that to light, and trying to gain the support of larger advocacy and legislative bodies, and hopefully get some of their backing when it comes to some of these issues. I've highlighted some of the other efforts that we're trying to work on specifically. Our committee in particular is trying to get a resolution geared towards telemedicine and universal internet access passed. So in a few weeks, by the end of April, we should hopefully have a better idea of how that did. We're kind of in the last stages of that. But otherwise, that's mostly what I had for you guys. Just wanted to give you guys an introduction into this, how to. Happy to share these slides with you, and I have a whole bunch of resources that I'd be happy to share if it's of interest. But any questions right now?
Yeah, so I'd love to ask you something, Daimler. Just as somebody who's kind of on the other side of it, who's kind of had a little bit of scaffolding and support in getting some of the healthcare advocacy stuff really started, from my first day of med school. I guess I was a Model UN kid, and I really came from that end, and I was able to get connected with some people. For those med students who are out there who may be viewing this and don't necessarily know what the first step is as far as getting into healthcare policy advocacy, as somebody who's been involved as kind of multiple levels, not just as your AMA chapter, but as like your as your state society as well. How did you get the connections that you've made?
Yeah, that's a great question, Phil. So for me, as I'm sure it is for you, kind of started out as an interest in healthcare policy. I too was a Model UN kid, so that gave me some exposure prior to starting medical school. But it kind of, for me, I came to find out through physicians, friends, that that there was that we had kind of like an advocacy day where everyone traveled to Baton Rouge, where we kind of took a look at our state medical society. Obviously, all of this was pre-COVID. We had great exposure and insight into everything that went on. I would tell anyone that's interested to look into see whether your school, where it stands when it comes to their medical societies. A lot of these institutions, try to garner interest in healthcare policy and advocacy, and so they have medical student-led efforts, medical student teams where they want representatives from your medical school that kind of that advocates specifically for your school, ultimately, and all the schools in your state. So that's I would say is a great first step, is to see if there is a state society in the state that you're in, which there should be, and to see if your medical school is a participating member within that.
Great. Well, thank you for that.
Yep. But yep, if there's no other questions, mostly wanted to share that. And I think for us specifically with NeuroEquity, I'd love to tease out a little bit more and see if we can get involved in that front with either the AAN or the AMA, or just kind of even in just listening in to understand more about neurology specific issues that are being addressed or talked about on a year-to-year basis.
Yeah. No, I appreciate this talk. I think we all appreciate it. I wanted to go back, actually kind of bring things full circle now back to the question that Daniel had said earlier. And Daniel, you can feel free to come on and participate this if you want, if you have any further questions. But I know he had mentioned specifically, how does this work basically when we're so busy as med students? I think it's really, it's really easy to be able to focus on this stuff when you're a little lighter on work, maybe earlier on in your med school career, like your M1, then M2 hits and you never come back around to it, or for whatever reason, you just become a little too busy to actually, take the actions that you'd really be interested in. Do you have any insight into that?
Yeah, so for me, I guess I was kind of on the other end of the spectrum. I didn't get too involved M1 or M2. I really had a chance to get involved during my clinical years 3 and 4. And a big reason for that has kind of been the exposure that the hospital setting gives you in seeing the issues that your patients are dealing with, and kind of where, why doesn't policy even always translate into the best patient care, and where is that gap coming from? So having just kind of seen that served as a lot of the interest behind me to do some of the work. So I think that as long as you're keeping your eyes and ears open, you'll see a lot of things in your clinical years 3 and 4 that I think will, as you're building your knowledge, will also give you the exposure and to try to right some of these issues.
Yeah, thank you for that. I'll also offer one piece too that I think has been kind of at the core of our healthcare policy team specifically, but NeuroEquity broadly also contributing to this, is that, we're a coalition. And I think one of the biggest pieces of that is to have strength in numbers. And I believe personally, as part of our mission here, is that you have less work individually when everybody is involved in a project. And that really leads to, the interesting idea of, what can you accomplish when you're able to involve more people in what you're doing? So I think personally that one way that you can kind of do all of this, and while you're still busy, is to, engage the people around you, and I guess find people who share common interests, and, seek that out, work on things together, so everybody doesn't have to work on, doesn't have to really bear the brunt of the load or anything like that. So that would be another piece that I would really give to that. And that's why I'm really thankful that we have people here at NeuroEquity who are interested in the same thing. And why I think just like specifically, it's like the specialty care oriented advocacy is something that's interesting to explore, just because you're really putting a pool of people together that are, specifically interested in the same topic.
Yeah, most definitely. And yeah, I think it's, like you said, a lot of that starts from what you're seeing within your specialty and seeing within your field. And, awareness and exposure is a great first step towards ultimately trying to enact some change and address these issues. But otherwise, that's mostly all I had for you. It's hopefully this was informative. I know it was a big learning experience for me, so I'm happy to hang around, answer any questions that might be out there. But overall, just want to say thanks, Phil, for having me on here.
Of course. I mean, it's a team effort. I wouldn't necessarily think of this as me having you on as much as, us all working together for this. We've all been involved pretty heavily in the planning of this. So I really appreciate you, being the solo speaker for this one and really bringing